Well, we're discovering more and more how our mental and physical health are essentially linked. Studies show depression can lead to an assortment of health problems, and chronic health conditions can increase the risk of mental illness. Psychiatrist Lateefah Watford has more. Doctor, I'm so happy to be talking to you, especially today, World Mental Health Day. Let's discuss how important mental health is in correlation to your physical and overall wellness.
You know, it's often that we discount our mental health as being something separate from or not a part of our overall well-being and health. However, it is an integral and very important part of our overall well-being. We have to take care of all parts of our patients and people to make sure that we're addressing everything that needs to be addressed and trying to make certain that we are treating patients for everything that they present with us.
So what can we do? How can people listening prioritize their mental health? Give us some easy tips.
I think the easiest tip is to accept that mental health impacts your life day to day, and recognizing that there are times that you have to sit back and make it a priority. For example, when bad things happen, like the pandemic we've been facing, it's important to take into consideration how your mental health is impacting your ability to work or interact with other people. It's important to give yourself grace. The same grace you give your best friend when they're struggling with something, try to give that to yourself. Not every day is going to be a good day, and not every day is going to be perfect. But everybody strives to do their best every day. And as long as you're doing that, you deserve the grace that you would give others to allow yourself to make mistakes. Making certain that you're doing self-care is also very, very important for your mental health.
And Doctor, you brought up the pandemic. Telehealth has come to the forefront, increasing access to care. How have those options provided access to people who were really needing those mental health services?
Telehealth services have been present, but not as prevalent as the pandemic kind of kicked it into overdrive. What's really exciting is because of the decreased number of behavioral health providers, particularly in our rural areas of the United States, adding the possibility of telehealth now extends services to people who didn't have access to mental health providers in the past.
But Doctor, there might be some people out there who still see telehealth as maybe not being as impactful, as effective because you're not in person. What do you say to those people?
Is there a difference? Absolutely, there's a difference. But the difference is minimal. There's still the ability to connect, even over the telehealth modality. In my own practice, I have found that many of my patients actually prefer this modality now, not only because they have access to do it, but they can do it from their home, which eliminates all of having to deal with traffic in Atlanta, which is never something we want to do.
Exactly.
And it also fits better in their day. So instead of having to schedule multiple hours, including transportation and getting to and from appointments, they now can shorten the time that it takes away from the other things they need to do in their life.
And, you know, we might have people out there who are still struggling. We really want to make sure that, you know, your message is so clear about how they can get the support that they need.
If you are struggling yourself, please reach out for help. You can reach out to your primary care physician. You can contact behavioral health providers in your community, whether it's a therapist or psychiatrist. If you know somebody or you have a loved one who is struggling, you can do the same. Sometimes a listening ear is exactly what people need to help them kind of sort through and then reach out for the help that they need and deserve to be better.
Thank you, Doctor. Always appreciate your time and your sage advice. We appreciate it so much. And we'd like to thank Kaiser Permanente for sponsoring that segment. Well,